Bad news today. We have a two-time PGA Tour winner, only 30 years old, died by suicide. His name's Grayson Murray, and here to make some sense of this, back on the show, Leigh Richardson from the Brain Performance Center. Explain to those of us who don't understand what depression is like, because I don't have depression. And how can a guy who's on the PGA Tour with some success, only age 30, feel that life is so bad, so bleak, so devoid of hope that he takes his own life?
You know, it's such a heartbreaking question that has to be answered, but it does. And I think he had struggled with depression and anxiety and some substance abuse on and off. And the sad thing is he had just come to the other side of that and felt like that he had walked past that. But I believe that suicide is a 10-minute decision that's made in the brain. And with depression comes that hopelessness, that feeling of not being connected, of being a failure, of not being able to do what you really have to do. And when you think about it, golf is an individual sport. There's nobody else that can come into play. The expectations that sometimes I think we all do, that we create for ourselves, are so high. And then when we don't meet them, particularly if we have depression, we've got a lot of negative thoughts in our head, all or nothing. If you didn't shoot 2 under, you're not worth a flip. And that pressure, that individual pressure, it accumulates. And I give him credit for being open and honest and sharing information. And I give every player on that tour the utmost respect. I can't imagine how hard it must have been to get up there and hit that ball thinking, that was my brother. I mean, that's a community.
Well, I hear you. What do we know about the substance abuse part of that? Not to blame substance abuse, but I was really perplexed when Robin Williams took his life, and I had heard in trying to keep up and trying to research on why someone as successful and universally loved, rich, famous, I mean, you think any of us would trade lives with Robin Williams. Why would someone like that think life is so bleak they have to take their own life? And one of the things I saw over and over was his substance abuse issues back in the day changed his brain chemistry, and now without the drug, they're just depressed in their normal state of being. Like, it's almost like a trade-off. Like, all that extra fun that you had because of drugs, you're going to have a void of fun in your sober life when you get done with that. Do you think that's part of what happened with this golfer?
Well, he's 30. He's fairly young, so the impact on the neurochemistry and the neurobiology that alcohol had, I honestly don't know. But I do think when you look at Robin Williams, because as you age, the brain changes. His brain had just finally gotten fully developed. And, there's 4 things that play into a dysregulated brain: genetics, physical head trauma, emotional trauma, and stress. And I can't imagine it being an individual performer, and I think he was 7 or 8 years that he played, and really had an amazing career. Some people never even went to PGA tours, and to do that by the time you're 30, that's amazing. But that's not the story that he heard in his head.
Well, do we know that there is a difference in the suicide rates between people who are, air quote, successful versus those who are at the bottom rung of society?
Well, I haven't seen a statistic. If you think back, though, in the last few years, the designer, the famous chef, we've seen it come into play more than we have before. But statistically, I have not seen that. What I think when we look at suicide is that it's the 4th leading cause of death for people in the age group of 15 to 30. So that tells you something.
Right. And, one of the things that seem counterintuitive in the suicide statistics that I've observed is that suicide is actually more prevalent in wealthy countries than it is in countries of a lower income status. And that kind of blew my mind. You would think, if you have all the luxuries and stuff that the first world has to offer, wouldn't you be happier, generally speaking, with life than these people who live in, a dirt floor, thatch roof hut?
Well, you would think, but it all comes down to how do you measure happiness? And that's an internal measure. And if you're dissatisfied with yourself, if you lose respect for yourself, if you don't value yourself, then, I've had so many people say to me, Leigh, it would just be easier to not be here.
Well, it's kind of hard to argue with that. Yes, it would be easier to not be here, but that doesn't make it better.
No, it doesn't.
All right, Leigh.
And it doesn't make it easier.
If someone feels like they may be going down a similar path as this golfer or Robin Williams or an Anthony Bourdain or Kate Spade, you brought up some good examples there. What do you recommend they do to rectify the situation, get some help?
Absolutely. You can always text or call 988. That's an easy number to remember, 988. And they're trained for suicide assistance. Reach out to family, reach out to a friend. And, just to close this conversation, what are the red flags? Look for abnormal behavior. He walked off the course and with only 2 holes left. That's abnormal behavior. How are they? Look for isolation. Watch the behavior, because that will tell you a lot. And I encourage friends and family and people that if you feel like somebody's down, ask them, how are you doing? And you'll get the answer. Oh, I'm fine. If you get that answer, come back. Well, I've been fine before. If you need to talk about it, I'm here.
All right. Thank you, Leigh Richardson from the Brain Performance Center in Dallas. Appreciate you talking about this on The James Show.